Hello and welcome to Bits and Atoms, the Grisham Robotics Founder Series. I'm your host, Elias Can, and today I've got Winnie Akadjo, founder and CEO of Aeli, joining me. To get started, Winnie, would you mind sharing a quick intro about you and Aeli?
Yes, thank you so much for having me on the show. So as you mentioned, I'm building Aeli, and essentially what I'm trying to do is to bridge the gap between therapy sessions. So for anyone who's gone to therapy or is thinking about therapy, there is generally 167 hours between therapy sessions, and that's about 1 week. And if you're not provided with the right tools and resources, you could actually struggle to manage your mental health within that time. So I'm trying to basically utilize AI as a way to support therapists in extending a continuity of care to their clients during that 168-hour period, but then also making sure as well that whatever clients are kind of getting up with or however they need to be supported is then translated back to their therapist so that they can work well together and strengthen their kind of like relationship during sessions.
Amazing. And I'd love to kind of jump in a little bit more to see for you personally, taking a step back from what you're working on, but maybe more of a look at you, what originally motivated you to become a founder? What's kind of your origin story of jumping onto the entrepreneurship side?
So I've always been an entrepreneur, I want to say. So from as young as I can remember, so when I was probably about 11, I used to sell food in school, and at the time this is when I kind of knew that, okay, maybe I was an entrepreneur at a young age, because to me it just made sense that you would buy food before school and to save money and then not have to pay the high prices in school. So I was really surprised that a lot of people weren't doing that. So I then just was able to then buy that food, bring it into school and sell it to people. And I guess that's where I kind of realized maybe I had a bit more of an entrepreneurial mindset in comparison to some of my classmates and the people that I was studying with. So those were my early entrepreneurial traits, but I didn't quite grasp it until a lot later. So I guess then it kind of showed up differently in the sense where I was always very ambitious. So having actually become a mom at 15, I was able to balance like studying, working, as well as kind of like taking hold of my responsibilities alongside. I think being quite resilient in terms of navigating different life scenarios and life changes and things like that as well. And I always come up with ideas. I was always able to kind of spot trends, changes and innovation, and I had so many ideas growing up, but I was just too busy to actually take the leap. So in the last 3 years I felt ready to take the leap, and that was to actually start building. But I think the characteristics of being a founder and entrepreneur was always there. It was just kind of like pruning in the background.
Yeah I love the early childhood story of selling food at school. I feel like a lot of founders have that like early instinct from a young age, and they don't know that they're going to be a founder in the future, but they resonate and are intrinsically motivated to be doing something like that. And wow, such a very interesting life story for you as well, in terms of becoming a parent at such an early age. I can't imagine having that much responsibility that early on. So I'm sure you're much more equipped to handle that than I would be.
I think there's definitely pros and cons. I think a big part of it is also why I'm building a mental health startup, because life did happen very quickly and I had my own challenges with my mental health along the way. But it's like no one prepares you for it. So I think everybody experiences it differently.
Yeah, and interesting that that's kind of what led you to building here as well. And I think maybe for listeners or readers who are less familiar with kind of the mental health or behavioral therapy space today, what are some of like the shortcomings in the market in terms of technology? Like, how are you improving the status quo? Yeah, it would be great to learn a bit more on that.
Yeah, so I think overall mental health care is it's becoming, but then it's also evolving. So I say becoming because it's only been in the last like 5 years we've seen the rise of like mental health platforms, even just matchmaking individuals to mental health care and being able to kind of like start to remove that stigma around therapy and actually speaking to someone. And we've also seen obviously a lot more discourse and diagnosis of neurodivergence across a whole range of people. So I think in one degree I say that it's becoming because a lot of these discussions and tools and technologies are now very much in the forefront. But then I also say it's evolving quite rapidly because of AI and how AI has actually been able to make a lot of changes, some good, some bad, in the mental health space and how it's going to kind of like what it will look like in the future. So I guess one obvious example is the fact that now you've got conversational AI, which is really helpful in terms of increasing accessibility to, to people who need access to therapy and they might not be able to get it through the traditional route. But off the back of that, there's also a lot of risks and limitations that also comes with speaking to conversational AI and how people are now engaging with chatbots and so on. And then on the other side, we can look at how AI is expected to be used for like diagnostics. So actually being able to spot mental health challenges in people a lot sooner, a lot earlier, and being able to kind of like provide interventions a lot sooner. So that's one angle. And then also just in terms of the industry as well. So how AI can actually benefit psychology in research, because psychology is still very much, there's a lot of research that hasn't been done. There's a lot of research that still needs to be validated across different ethnicities, groups, lived experiences, and that's one of the ways that AI can help. So a lot happening in this space, which is very exciting. And I think from Aeli's standpoint, for us, it's really looking at, okay, how can we use AI for preventative healthcare? So to actually help people kind of like either support themselves when they're in the therapy room, outside of the therapy room. How can we use AI in terms of like early stage interventions or diagnostics to support medical professionals, and as well as that, how could we also use it from like a generative standpoint, so actually giving more autonomy to the professionals to perhaps create more personalized treatment plans, interventions and tools for a diverse range of people.
Yeah, very interesting. And the diagnostic piece is interesting, and would love to kind of double click there, because I think like maybe the first wave of mental health was more of like this phenomenon of being able to speak with someone online or not have to go see an in-person provider. And I'm thinking like a Talkspace or platforms like that kind of were the first wave of telehealth. But to your point, that's a session where you get to directly see and react to how the client or patient is acting. But there's all this space in between when the therapist can't see them or the professional can't see them, and that can be like a highly risky period as well. For the diagnostic side, are there any kind of like, from what you're seeing so far, any like triggers or warnings or ways that you're collecting data to maybe get a sense of like a patient being at a high risk juncture or something like that? Curious like how that diagnostic period can kind of work.
So at the moment, I'm actually really excited about deep diving into AI usage. So as you know, a lot of people are now using LLMs as a way to kind of like talk about their personal and emotional well-being. And I think there's a lot of data there that can actually be used as a way to understand people's like mental health state and also to spot different patterns over time. So that's the space that I'm quite interested in exploring next.
Absolutely. And you bring up the chat piece, and I think you'd have to be living under a rock for the last 3 years to not know about all of these generalist chat platforms now, like ChatGPT. And folks will try and use that for maybe mental health guidance, but probably not recommended to do so. And kind of how do you position Aeli compared to like generalist platforms? What do you feel like are some of like the key differences for what you're building versus the very broad generalist platforms that folks are using for a wide range of use cases, essentially?
So I think it's the fact that it's coming from their particular therapist or from their particular kind of like medical professional, because although this 168 hour gap exists, it's not like it is being preoccupied by other things, a whole range of other things. For some people, it could be, bad coping mechanisms, so kind of result into things that is not good for their mental state. For some people, it could be reading books about their mental health. For some people, it could be exercise. For some people, it could be social media. So actually, between therapy sessions, there's a whole range of things that people are already doing, but it might not actually be what's recommended by their therapist. It might not be what's best suited for them, and it might not actually be helping them progress on their mental health journey. So, and I think chatbots have also become part of that kind of like, filling in that gap between therapy sessions. So what we're trying to do at Aeli is actually give that power to therapists, to individuals who know them best. They really understand like what they need support with, what will be best suited, what will help them from kind of like on their own journey, and allow them to be able to extend that continuity of care.
Yep. And I'm guessing for Aeli, you partner with the therapist or the practice first, and then the way to interface with the end customer or end user is through the therapist as well. It's not a pure push to like a direct to consumer product for you.
Yes and no. So yes, we are definitely going through therapists. So that's one of our core customer bases where the therapists can extend the tool to their clients. But at the same time, we also see a really strong case in terms of empowering clients to take more ownership on their space between therapy sessions. So looking at actually launching our B2C value proposition in the next couple of weeks, which is really exciting.
Amazing. Yeah. And you'll be balancing between more B2B sales, B2C efforts in terms of go to market. And I guess so far for the therapist side, since you've been more active there so far, have there been any really good channels or ways for you to get in front of folks on that side, like good ways that you've been able to open doors and kind of establish some of these partnerships?
So what's really worked was direct email outreach. So just emailing therapists and actually just being really transparent about what I'm working on, what I'm looking to do, and engaging with them that way. So I found that to be the most kind of like most beneficial way to actually engage with therapists and have honest conversations about the work that I'm trying to do. Following that, I think it's then forming kind of like relationships with individuals who are working with therapists. So one of the things that I'm doing soon is I'm running a CPD event with a therapy practice group on how therapists can actually start using AI in clinical settings. So that's one way to kind of like engage with a community that already has like a group of therapists that they're working with and being able to kind of like facilitate it that way. Another way is going to events. So I'm a member of the Butcher Psychology Society, and that's allowed me to go to different events and actually start building relationships with professionals in that space as well.
Yeah. And I'm sure the face-to-face time can be helpful on that side as an extra layer of trust and putting a face behind the name of the company and everything like that.
Exactly. Like, yeah, community. I think because of the ethics and kind of like the moral component of the occupation, you can have real, genuine, honest conversations with just, individuals, and you just get their standpoints. That's been great. And I'm also part of a really good community as well that's at the intersection of AI and mental health.
Very nice. Very nice. And maybe one last question here, because I'm curious to go in a little bit of a different direction to get some of your thoughts here. And just because I'm always curious to see from the founder perspective, what's kind of worked well for them. Have there been any best strategies or best practices for you so far on the fundraising side? Any tips or tricks for raising that round, or finding good fit investors? It's always something that founders are asking me about, and always love getting the perspective from people who are actually doing it.
Yeah, so I think for me, definitely go niche rather than going broad. And I think for two reasons. One, I'm working within the healthcare space and I'm working within the mental health space as well. So there isn't a huge pool of investors that I can kind of like go speak to and stuff like that. So it means I do have to be a little bit more, careful around picking investors that would be best suited, that would have an interest in the business, and that would also understand the hurdles that I have to go through, because there's a lot of regulation. There's a lot of trust building. So it means that I am having to work a lot slower than I would like to, and things just take a little bit longer. So for me, it's really important to align with investors who understand that. So I think just optimizing for your industry and what you're building for, and finding investors that align with that rather than going broad.
Absolutely. And yeah, healthcare can be, given the sensitivity of the data and the outcomes, it's definitely hard to just, whip something up, have it, the classic motto of run fast and break things. Tough to do it in healthcare because there's really, sensitive outcomes that can happen. It's not like, a social media product or something like that.
Exactly. But having said that, there are other things you can do. So I think for me, what's been working really well, or at least what I'm trying to optimize for, is like, content marketing. So, talking a lot about what I'm building, utilizing LinkedIn, sharing newsletters, hosting events. So kind of building community alongside going through the product journey.
Absolutely. Yep. That makes sense. And with that, we're at time. And so I want to thank you, Winnie, for joining me today on Bits and Atoms. It was great to have you here. I'll let you get back to building and have a great rest of the week.
Thank you. You too.